necessarily.
Is that going to knock that out of the box?
Oh, no. Medicare's going to stay the way it is.
Where are you, in the Boston Globe?
Yeah.
Where, in the plant?
Thank you, Sanjay, and thanks everybody for being here. It's been a great 2 months out on the campaign trail, and I really appreciate you coming. We're going to really talk about a defining issue of this campaign, and I think a defining issue for America. When I announced my candidacy for the United States Senate, I said that the American dream is under siege today, in large part because of the health care system that leaves too many without coverage, many more paying too much for insurance, that fails them when they need it most. Today in America, we find ourselves at a crossroads. It's a fundamental health care reform has passed in the House by the narrowest of margins. Almost didn't pass. The passage of this bill is a historic achievement, and I commend Speaker Pelosi and every member of the Massachusetts delegation and all 219 Democrats and 1 Republican for their vote in favor of health care reform. Now this debate moves to the United States Senate, and I want to congratulate Senator Reid for his leadership in bringing this strong bill to the floor. But in order for a health care bill to pass the procedural obstacles in the Senate, we will need 60 votes, and I will be that 60th vote. I'll be a reliable vote for health care. I think it's essential that before they cast their vote in this election, the Massachusetts Democratic primary voters understand where each of the candidates in this race stand in respect to this fundamental issue of whether or not their next senator will cast that 60th reliable vote for health care. I believe in unequivocal support, public support of health care legislation, like the bill passed by the House, is a minimum standard that voters have a right to demand from every candidate for this seat. This standard of public support should exist even if a bill contains some language or provision which could cause a stumbling block, like the Stupak-Pitts Amendment. Support for reform, in my view, is a prerequisite for any Democrat who aspires to fill the seat held by Senator Kennedy for so many years. I think the voters should demand nothing less from our next senator than a pledge that you will be there when the 60th vote is needed. I regret that 2 of my opponents in this race, Attorney General Martha Coakley and Congressman Michael Capuano, have failed to meet this test. They will not be a reliable 60th vote in favor of health care reform. Indeed, both have stated publicly that they will oppose this health care bill that passed the House if one like it emerges from the United States Senate. Attorney General Coakley has said that this is a false choice, but it is, in fact, a very real choice that Congress will face as they negotiate the final version of the bill. In that context, the voters of Massachusetts deserve to know that their senator will stand up as a vital 60th vote for health care reform. The reason for their opposition to the bill revolves around a single aspect of the health care bill, the so-called Stupak-Pitts Amendment, which provides a mechanism by which public funding for abortion would be excluded from health care coverage. While I disagree with Stupak-Pitts, I do not believe that this language or similar provision should stop the passage of health care reform. This represents a fundamental disagreement between 2 of my opponents and me. Senator Kennedy called the fight for universal health care the cause of his life. In writing about the bill that was published before his death in Newsweek magazine, Senator Kennedy said, "Everyone won't be satisfied, no one will get everything they want, but we need to come together, just as we've done in other crises, World War II, the Cold War, the civil rights laws in the 60s, and in daring to send a man to the moon. If we don't get every provision, we can adjust and improve the program next year or in the years to come. What we can't afford is to wait another generation." He was talking about the fact it's been far too long to get people covered in health care, all Americans. Senator Kennedy was right about this issue, and I stand with him on this issue. We cannot afford to wait another minute to get health care reform and get everyone covered in America. The fight to fundamentally reform health care in America dates back to the earliest part of the century. Theodore Roosevelt took it up. Harry Truman fought for universal health care, as did John Kennedy, Lyndon Johnson, and Lyndon Johnson signed Medicare into law. We all know Bill Clinton fought to pass health care reform and was stymied by lobbyists and special interests. Healthcare reform has failed, from Harry Truman to Harry and Louise, and now it's the time to make it a law. I believe that Senator Kennedy would not take the position that Attorney General Coakley and Congressman Capuano have taken on this issue, and his own words are proof of that. My belief is that he would not have done so supported by two of people who knew him best, his two sons. Patrick Kennedy said last week, for anybody running, especially for my dad's seat, to condition their support on an issue as to whether they're going to vote for it or against it, to me, misses my dad's legacy of health care for all. Congressman Kennedy said the candidates in the Senate race should not apply a litmus test that could derail universal health care, and I agree with him. I also agree with what Ted Kennedy Jr. said last week. He said his father wouldn't want to go backwards on reproductive rights, but he thought the perfect is the enemy of the good. He said, if you have a good bill, you should pass it and not wait for the most perfect piece of legislation. I agree with Ted Kennedy Jr., and I'm sure his father would have agreed with that sentiment as well. That's why I hope Attorney General Coakley and Congressman Capuano will reconsider their position in opposition to health care legislation that passed the House, should something like it pass in the Senate.